EMT Prometric questions and answers. Questions 41 to 70. 41. You arrive at the scene shortly after a 55-year-old man collapsed. Two bystanders are performing CPR. The man's wife states that he had cardiac bypass surgery approximately 6 months earlier. There are no signs of trauma. After you attach the AED and analyze this patient's heart rhythm, the machine states, shock advised. What cardiac rhythm is the patient most likely in? A. Asystole. B. Ventricular fibrillation. C. Ventricular tachycardia. D. Pulseless electrical activity. The answer is B. Ventricular fibrillation. 42. Immediately upon delivery of a newborn's head, you should first A. Dry the face. B. Cover the eyes. C. Suction the nose. D. Suction the mouth. The answer is D. Suction the mouth. 43. You assess a newborn with cyanosis to the chest and face and a heart rate of 90 beats/min. What should you do next? A. Resuction the mouth. B. Briskly dry off the infant. C. Begin chest compressions. D. Begin artificial ventilations. The answer is D. Begin artificial ventilations. 44. An EMTBS failure to obtain consent to treat a patient could result in allegations of A. Battery. B. Negligence. C. Abandonment. D. Breach of duty. The answer is A. Battery. 55. Which of the following describe the most appropriate method of performing chest compressions on an adult patient in cardiac arrest? Compress the chest to a depth of 1.5 to 2, allow full recoil of the chest after each compression, minimize interruptions in chest compressions. Allow full recoil of the chest after each compression, compress the chest to a depth of 2 inch, deliver compressions at a rate of at least 80 per minute. Do not interrupt chest compressions for any reason, compress the chest to a depth of 1.5 to 2, allow partial recoil of the chest after each compression. Minimize interruptions in chest compressions, provide 70% compression time and 30% relaxation time, deliver compressions at a rate of 100 per minute. The answer is A. Compress the chest to a depth of 1.5 to 2, allow full recoil of the chest after each compression, minimize interruptions in chest compressions. 56. Prevention of cardiac arrest in infants and small children should focus primarily on A. Keeping the child warm. B. Avoiding upsetting the child. C. Providing immediate transport. D. Providing airway management. The answer is D. Providing airway management. 57. You are managing a conscious patient who you believe is having an acute ischemic stroke. After administering oxygen, your next priority should include A. Providing prompt transport for possible fibrinolytic therapy. B. Determining whether the patient has been prescribed nitroglycerin. C. Closely monitoring the blood pressure. D. Completing a detailed physical examination before providing transport. The answer is A. Providing prompt transport for possible fibrinolytic therapy. 58. Which of the following patients with diabetes should receive oral glucose? A confused patient who has cool, clammy skin. B. A confused patient who is suspected. C. A semi-conscious patient with pale skin. D. An unconscious patient who took too much insulin. The answer is A. A confused patient who has cool, clammy skin. 59. During a bar fight, a 22-year-old man was stabbed in the chest with a large knife. The patient is pulseless and apneic, and the knife is impaled in the center of his chest. Management should include A. Stabilizing the knife, starting CPR, and providing rapid transport. B. Stabilizing the knife, applying an occlusive dressing and providing rapid transport. C. Removing the knife, starting CPR, and providing rapid transport. D. Removing the knife, applying an occlusive dressing, and providing rapid transport. The answer is C, removing the knife, starting CPR, and providing rapid transport. 60. In which of the following patients would nitroglycerin be contraindicated? 41-year-old male with crushing chest pressure, a blood pressure of 160/90 mmHg, and severe nausea. 53-year-old male with chest discomfort, diaphoresis, a blood pressure of 146/66 mmHg, and regular use of Cialis. 58-year-old male with chest pain radiating to the left arm, a blood pressure of 130/64 mmHg, and prescribed Tegretol. 66-year-old female with chest pressure of 6 hours duration, lightheadedness, and a blood pressure of 110/58 mmHg. The answer is B, 53-year-old male with chest discomfort, diaphoresis, a blood pressure of 146/66 mmHg, and regular use of Cialis. 61. Firefighters have rescued a man from his burning house. He is conscious and in considerable respiratory distress. He has a brassy cough and singed nasal hairs. The most immediate threat to this patient's life is A. Hypothermia, B. Severe burns, C. Severe infection, D. Closure of the airway. The answer is D. Closure of the airway. 62. You respond to a call for a shooting at a local bar. You arrive at the scene and find a young man sitting against the wall, screaming in pain, with bright red blood spurting from a wound near his groin. What should you do first? A. Ensure an open airway. B. Administer 100% oxygen. C. Apply pressure to the wound. D. Transport the patient at once. The answer is C. Apply pressure to the wound. 63. Patients with closed head injuries often have pupillary changes and A. Paralysis, B. Paresthesia, C. Hypertension, D. Tachycardia. The answer is C. Hypertension. 64. When assessing a patient with a reduction in tidal volume, you would expect the respirations to be A. Deep, B. Labored, C. Shallow, D. Dyspneic. The answer is C. Shallow. 65. Prior to applying a non-rebreathing mask on a patient with difficulty breathing, you should A. Set the flow rate to no more than 10 liters per minute. B. Pre-fill the reservoir bag to ensure delivery of 100% oxygen. C. Insert a nasopharyngeal airway to maintain airway patency. D. Perform a complete physical examination to determine the degree of hypoxia. The answer is B. Pre-fill the reservoir bag to ensure delivery of 100% oxygen. 66. A 60-year-old woman is experiencing severe respiratory distress. When you ask her a question, she can only say 2 words at a time. You should manage this patient by A. Inserting a nasopharyngeal airway, B. Providing positive pressure ventilations, C. Applying a nasal cannula set at 2 to 6 liters per minute, D. Applying a non-rebreathing mask set at 15 liters per minute. The answer is B. Providing positive pressure ventilations. 67. The most effective method for determining whether you are providing adequate artificial ventilation is A. Assessing the chest for the adequate rise, B. Assessing the pulse for an improving heart rate, C. Checking the pupils for increased reactivity, D. Checking the skin for improvement of cyanosis. The answer is A. Assessing the chest for the adequate rise. 68. You are administering oxygen to a woman with asthma who took 2 puffs of her prescribed inhaler without relief prior to your arrival. Your next action should be to A. Contact medical control for further advice, B. Administer 1 more puff from the inhaler, C. Provide immediate transport to the hospital, D. Confirm that her inhaler is prescribed to her. The answer is A. Contact medical control for further advice. 69. Unconsciousness, shallow breathing, and constricted pupils are most indicative of what type of drug overdose? A. Narcotic. B. A marijuana. C. Barbiturate. D. Amphetamine. The answer is A. Narcotic. 70. When dealing with an emotionally disturbed patient, you should be concerned with A. Providing safe transport. B. Whether the patient could harm you. C. Obtaining a complete medical history. D. Gathering all of the patient's medications. The answer is B. Whether the patient could harm you.